Hello, we are graduate nursing students in Seattle University's Master's Program in Nursing, and we're here to talk to you today about skin-to-skin contact of the baby and doing the newborn exam on the mother's chest immediately after delivery. Skin-to-skin contact is also known as kangaroo care with premature infants, and it's when the baby is placed directly on its mother's chest after birth. This is in contrast to the baby being taken directly to the warmer or placed on a towel or in a crib. Sometimes the baby might be placed on the partner's chest if the mother needs some extra help. Skin-to-skin contact is important because newborns are at risk for getting cold quickly. Due to their minimal insulating fat, their thin skin that allows water to pass through it easily, and their large amount of exposed skin compared to their small body weight. Putting the baby directly on the skin without a blanket between the chest and the baby's chest allows for heat transfer to keep the baby warm. Putting a warm, dry blanket on top of both helps keep the heat trapped in. So we will briefly be simulating a delivery, but the main focus of this video will be on the newborn exam on the mother's chest. And I will be playing the midwife, and Lindsay will be playing the nurse.
You're doing great, Sue.
Okay, Sue, you're almost there. Just give me one more strong push. Good. Your baby's head is almost out. Good.
So much pressure.
You can do it. You've almost got your baby. Okay, I'm gonna reach down and hold your brand new baby girl.
Gosh. Oh, she's so beautiful. Hi, baby girl.
So after the nurses hear the lusty cry from the baby, they are stimulating the baby and drying it off with the towels. Notice that the baby is directly skin to skin on the chest, and its head is tilted in such a way that it continues to drain the secretions from its chest. A dry blanket is now placed over the baby, and another blanket will also be placed over mom in order to trap in some of that heat.
Congratulations, Mama.
Thank you.
So now the newborn exam can begin. Starting at the head, Lindsay's able to palpate the sutures and the fontanelles, feeling for any bruising, or observing for any bruising and feeling for any caput. She's able to move to the ears, looking for skin tags, and observing for patency of the ear canal. Moving forward on the face, she's able to see how the ears line up with the eyes. And then moving down the face, able to check the patency of the nostrils. For the mouth, Lindsay is going to stick her finger in the baby's mouth, feeling for the suck reflex, and then also feeling for any signs of cleft lip, cleft palate. Moving down the baby's neck, while keeping the blanket covering the baby, she's going to be feeling the clavicles for any sort of bruising and crepitus. Now she's going to continue to keep the blanket pretty close to the baby while she feels the arms, which will be difficult for you to see in the video. Making sure that both of the arms are moving well. And then also looking at the hands for any creases. Now she's going to have to move the blanket a little bit to be able to peek at the baby's back and follow the line down the back and inspect, especially at the tailbone, for any spots or dimples. Now she'll also check the anus for any patency. And then she's also able to check the skin folds and count the number of toes and look for creases on the bottom of the feet. She's able to replace the blanket. And now she can go ahead and listen to lung sounds on the baby's back. Noting that she's going to listen for an entire minute, but for the purpose of this video, she's going to now move her stethoscope to the front and listen to heart sounds again for a full minute. A minute has passed, and now she's going to be observing the front of the baby She's already felt the clavicle, so now she's going to be feeling the breast beds. Observing. And then now she's going to be palpating the abdomen for any gross abnormalities. She can check her pulses by checking first for the brachial artery in the arms simultaneously. And now she can move her hands down and check for the femoral artery. And now what she's going to do is be looking at the umbilical cord, making sure that that looks healthy with its insertion. And then she's also going to inspect the baby's genitals. As well. Now she can make sure that the baby is covered. She can put a hat on the baby. And then take the baby's temperature. Although it will not be demonstrated in this exam, it is still possible for the baby to be given the vitamin K, hepatitis B, and erythromycin treatments while on mom's chest. Baby will be calmer if it's given in this fashion. And there's an example of how to do a newborn exam on mom's skin-to-skin contact.
And the purpose of the immediate newborn exam is to ensure that the baby is stable and that no immediate interventions are needed. A more comprehensive exam can be deferred until after the first hour of life to allow for this important time right after the baby is born to bond with its mother.